we just want to cover a few of the techniques that you guys will need to use when you work on isolating plant DNA. First is to always remember to label your tubes. It's very important so you don't lose track of any of the contents. I would suggest labeling your tubes with either the leaf name or your name. And it's best to label both on the top and the side. Once you have your tube labeled, you can begin to the process of grinding your leaf. Now, you just need to take about a pinky's nail size worth of your leaf and add it to your 2 ml tube. Then add a small amount of sand, about half the volume of the size of your leaf, to the tube. Use the pestle from the package to grind the leaf with the sand and pulverize the plant tissue. This may take some time. You will see that a lot of the veins with the leaf will remain intact, but you will have fine green sand at the bottom of the tube. Alright, so some of my leaf has been ground into small pieces. Next, you will need to add liquid to your tube. To do this, you will pipette to the first stop, take up your volume of liquid, and then add it to the tube. Another important technique is to vortex. So to vortex, just press your tube into the center of the vortex. This helps to mix up the solution that you'll need to pipette. Next, you will need to take off the supernatant, which is the liquid on top of the tube, and transfer it into a spin column. To do this, try to remain on the side of the tube and near the top of the liquid volume. And this way, you will not suck up any of the solid waste. Now your spin columns, again, also need to be labeled. These spin columns will come apart. They're in 2 pieces, the column and the tube below. When you add volume to the spin column, you want to add directly to the center. You'll see a white column in the center of that. Once added, you can close your spin column up and centrifuge your spin column. You'll need to remove the flow through of your spin column, which will occur after centrifugation, and to do that, just dump off the flow through into a liquid waste container and continue on with your procedure.